everyone, and welcome to today's webinar, How Biometric Data Can Help Health Plans Close the Information Gap. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through just a few quick housekeeping instructions. So first, we will begin today's webinar with a presentation, and there will be time at the end of the hour for a question and answer session. So you can go ahead and submit any questions that you have throughout the presentation by typing them into that Q&A box that you should see on your screen. And today's session is being recorded as well, so it will be available after the event. And you can use the same link you used to log into today's webinar to access that recording once it's available. And finally, if at any time you don't see your slides moving, or if you have trouble with the audio, just try refreshing your browser, and you can also use that Q&A box to submit any technical questions that you might have. We're here to help with that as well. So with that, I'm pleased to welcome today's speakers. First, we have Susan Beaton. Susan is an innovative and collaborative healthcare industry executive with a passion for engaging consumers outside the four walls of healthcare. She has over 25 years of experience as a clinical nurse leader and health plan executive, and joined Wellframe from Blue Cross Blue Shield, Nebraska, where she served as Vice President of Care Management, Provider Services, and Risk. Next, we have Rachel Darasek, Senior Director of Product Marketing at Wellframe. Rachel is a strategy and marketing executive focused on using tech to improve healthcare. She brings 20 years of experience across marketing and strategy, customer access and sales, and operational excellence. Most recently, prior to joining Wellframe, Rachel held Vice President of Marketing roles at Tetra Science and Lux Research. She holds an MBA from the Kellogg School of Management at Northwestern University, as well as a Master's of Engineering in Product Innovation and Design. So next, I will go over today's presentation. So we will cover the barriers to owning biometric monitoring, and then we will go over the drawbacks of outsourcing, the framework for designing an effective biometric monitoring strategy, and finally, we will go over some key takeaways. So Susan and Rachel, thank you so much for being here today again. And Rachel, I'll now go ahead and turn the floor over to you.
Great, thank you, Erica, for that fantastic introduction. So before we jump into the remote patient monitoring biometrics discussion, we wanted to just give a quick overview of Wellframe for those of you who may or may not have heard of us before. Wellframe is the digital health management company. We have a vision of helping every person feel confident, cared for, and supported by the healthcare they have every day. Now, contrast that vision with the stereotypical experience of being a member of a health plan. So when I first joined Wellframe and I was telling my parents what I did, they're almost 70, they're Medicare Advantage members now. The first reaction, before I even got all of the words out of my mouth, the reaction they immediately had was, oh, I hate my health plan. They just want to deny all my claims. Now, yes, my parents are turning into grumpy old people, but I don't think they're alone in feeling this way. And quite honestly, that's one of the reasons I joined Wellframe, to help change this perception. So instead of feeling confident and cared for and supported, as the story about my parents demonstrated, a lot of times people feel confused or overwhelmed or frustrated. So at Wellframe, we like to imagine that member experience feeling kind of like a maze, where people don't know where to go, what to do next, or sometimes even who to trust. So that's what we do at Wellframe. We help health plans reimagine their member relationships and their member experiences to break down the walls of that maze, reducing friction and cultivating a healthy relationship between members and health plans. We use technology and data to make the member experience convenient and personalized. And we don't just implement the technology and walk away. We help staff optimize their channel mix. That's the use of chat, telephone, video, email, et cetera, to efficiently scale their workflows. And that's what we mean when we talk about welcoming members to Wellframe World. Now, it can be the Wellframe brand or the health plans brand, which is actually what we prefer. But it provides a single convenient location where members can access all of the resources from their health plan via a mobile app. So whether members need active management support like digital care management, on-demand or self-service information to answer questions about navigation or administration of benefits, or if they just want to easily connect with a human, a staff member on the health plan side, via the channel that's most convenient for them, which is usually some kind of a secure chat feature. And ultimately, it all culminates in a shift to an experience where members feel supported and cared for by their health plan. Our customers differentiate their products and improve quality measures and satisfaction by organizing their resources around their members to support them every day, in between clinical encounters, over time, and at scale. Remote patient monitoring has been built into our platform essentially since day one. We've learned a lot over time, but as we all know, this space is evolving rapidly. And that's why we're here today, to discuss this super hot topic and a few things that we've learned along the way. So let's jump into it. We've already used the term remote patient monitoring and RPM a few times. But I know that this term is interchangeable with a few others, and different folks might have a different interpretation of what exactly that means. So for today's discussion, we thought we would just level set and make sure we're all working off the same definition. So the definition that we use for remote patient monitoring is using digital technology to collect medical and other forms of health data from individuals in one location and electronically transmit that information securely to healthcare providers in a different location for assessment and recommendations. Now, there's a lot in there, and we'll get to unpacking that as we go through. But no matter which way you slice it, RPM is a major trend. Depending on your favorite analyst, they're projecting anywhere from a 2 to 4 billion with a B dollar market before 2030, which is only a few short years away. Now, when you think of RPM, biometrics is usually the first type of data that comes to mind. But I personally found it interesting that monitoring or gathering data about symptoms, medications, and treatment information are also considered types of RPM. So why is RPM important? Obviously, a lot of people are talking about it, but do we really stop and think about why? There are the obvious benefits of safety and comfort for patients, or in this case, members. It can enable earlier interventions. It can increase the type and volume of data available, which can have tremendous benefits, especially as we think about all the applications of AI that we have these days. There are even some studies showing that people who remotely track their data are more engaged in managing their own health, which can improve compliance and adherence. And it can facilitate personalization, which we know is something that everyone wants these days. And it can facilitate personalization at scale as well. So, Susan, we've set the stage for remote patient monitoring and biometrics. We hear about a lot of different use cases: home health, post-op or transitions of care, remote clinical trials, aging in place. Usually these use cases are supported by providers or health systems or a third-party vendor. But at Wellframe, we have a little bit of a unique position on this. Even though all of those other stakeholders are absolutely in a position to take advantage and use RPM to help members or patients, we also think health plans are in a position to use RPM in new ways to support their members. So this is where I'm hoping to spend a lot of time today picking your brain based on your experience in the health plan and how you thought about RPM on your team. So can you start off by giving us a little context from your perspective?
You bet, I'd be happy to. It's interesting how you talk about the growth of digital in general, and with that comes RPM. So health plans usually have a lot of data points at their fingertips, whether it's claims data, customer service data. But the one thing that growth definitely is seeing the need for, and what health plans are experiencing, is in the digital atmosphere, as I call it, and really bringing in that RPM and those biometrics to it. And I think we've seen that. I think a lot of people, and you'll hear this in conversations coming up all the time now, is the pandemic, right? And how that's pushed us to this market and pushed it in high gear. And forced employers as well as health plans to adjust to that digital healthcare solution faster than anticipated. I think health plans have brought it in a little bit at a time, but I think when you have to scale fast and look at the opportunities to bring all those biometrics and RPMs into play, then the health plans really have to concentrate on bringing digital first and making a digital first organization out of their care management programs and engagements with their members. And you can see here on the slide, I'm sure a lot of people today listening on the webinar feel this as well. If you spend time not only with your members, but their employers and their employer groups, that they agree as well that virtual care is here to stay, has a vibrant role in healthcare delivery. And really an article that we recently read in 2021 shows that it's up 52% since 2018, actually employer groups feeling that virtual care has a significant role. And that's 8 in 10 large employers. That's a huge amount. So those are our clients and our customer base and where our members come from. So we know that our employer groups want this. And I had that firsthand when I went out with our sales team and listening to our employer groups and our brokers, that these types of services are necessary. These are table stakes now, and our members are consumers, and they're saying the same thing. And really, our competitors as a health plan are out there in that digital ecosystem world also producing these types of RPMs and biometrics. So extremely important as a health plan when you're going to serve your consumer as a whole person and your member, that digital healthcare solutions and biometrics needs to be a significant part of those interactions.
Absolutely. I mean, it's 2021. Almost every other industry has been working on digitally transforming for years and years at this point. I know as a person, I am very much looking forward to healthcare continuing to transform. And, as devastating as this entire pandemic has been, I think that's one of the silver linings that's come out of it. So, Susan, you alluded to this, but, you were saying you would go out in the field and meet with employers, and your sales folks would come in and, they would make the request of you. Our employer groups are asking, what are we doing about biometrics? What are we doing in remote patient monitoring? How can we compete? So how would you answer that type of situation back when you worked at the health plan?
That was something that immediately, as I went out firsthand and heard back, right, it was yes, of course, we want to do that. And our nursing teams always want to do the most for everything for our members. But the first thing that I thought about that was, well, how am I going to do all of that? When I think about what's entailed in bringing digital to an enterprise and bringing digital to the care managers, and to do it at scale and efficiently. So the first thing is I'm like, okay, I'm going to bring it in. I'm going to say yes. But then how am I going to bring that RPM solution back in? So I don't want to be able to do it by adding more staff. You just can't hire, 5 or 6 more nurses. When you think about the bottom line and your admin costs at a health plan, you have to be cognizant of that, because that then reflects back to your employer groups and the pricing. So it was, okay, I have this many maybe members that need to be reached. So we'll take diabetes, for example, glucometer readings and bringing in that biometric piece alongside the data points that we already had as a health plan with claims and all of that, and not add staff. And how do I do that efficiently? And so it was really became the math doesn't add up, right? I can't have this many people. I'm going to do it with the same amount of nurses that I have, but I have to do it smartly. So really thinking about how to do that, how to bring that in and stay competitive and make sure that we're offering our employer groups and our consumers all of the tools that they need to lead healthier lives.
Yeah, that makes sense. I mean, with the workflows, from what I understand when we've talked about this before, they're very person-based and telephonic-based. So in order to add more to the workflow, that means something has to change. So you either need more people or you need different workflows. So I can imagine at a large organization like a health plan, the immediate knee-jerk reaction is we need to add more people because that's what you're with. But then like you said, you do the math, and in order to pass along those costs and continue to make a profit, now your plan's not really price competitive anymore. So that leads you to the solution, which is, well, I guess we're going to have to outsource. We're going to have to find a vendor who can do this for us so that we can offer it to our employers through the plan, but at a lower cost. So let's talk about that for a second, because when you outsource something like this, like RPM or biometrics, there's some serious considerations. So the first one that comes to mind to me is, what is that member experience when you outsource something like this?
Rachel, I think to your point, and I'd have to say is the first things when you, even going back and you asked me, what did I think when, the sales team and the employer groups wanted me to bring that in, I knew immediately, and so did our nurses, that those biometrics, right, and bringing that information, that digital, belonged in the relationship that the health plan already had with their members. So I felt very strongly about that. There was no way that we should be giving up that relationship that our nurses already built with the members. And so that leads directly to that member experience. And we can't add more fragmentation to the experience they already have, going back to the maze that you showed in the front. So even if there would have been, how am I going to do that? How am I going to bring that back into the health plan and be competitive? I didn't want to outsource that. We spent a lot of time and energy on the health plan side already building that relationship. So I think of that in three perspectives and user perspectives, is thinking about not just the members, but the health plan staff and then the plan itself. So even meaning branding and differentiation, and what does that mean to a member or to the frontline staff that we're going to use the RPM and bring in the biometrics opportunity to engage members. So I think first and foremost was, I didn't want to go on outside those four walls, that we have so much data and information within the health plan that we needed to add this to our mix, right? This is the logical next step. And so especially thinking about the members we were going to start with in care management and the chronic diseases that they had, to outsource it to a potentially one-point solution and only address one condition didn't make sense. So we know from a lot of either the claims data or the interactions we have with our members that usually somebody with a chronic disease has more than one. So they could have diabetes and high blood pressure, obesity, all of those things that were usually in the top 5 discussion conditions with our employer groups about what we were seeing about their members. So that just meant, how am I going to track multiple biometrics? And I can't have them in disparate solutions that my nurses don't have access to. So bringing those biometrics back in-house as well, and supporting the member in that.
Absolutely. I mean, the fragmented member experience is, I'm a working mom with 2 kids. I feel like every device I bring into my house these days has its own app. And sometimes it works and sometimes it doesn't. And if it doesn't work, there's no chance of me getting to it. And I don't have multiple chronic conditions that I need to think about. So I can't even imagine how hard it would be for those members who are trying to track that kind of thing. So that you mentioned 3 key stakeholders, members, obviously, first and foremost, because we can build all kinds of amazing solutions, but if it's not user friendly, it doesn't really matter because nobody's going to build it. No one's going to use it. But there's also the challenges of outsourcing when you're thinking about the staff, and tell us a little bit more about what your staff was thinking about or feeling when you worked with outsourced solutions.
I think the one thing is we are trying to reach the same goals for our member is making it easier for them to do business with us. We think about all the member journey time that we spent investigating how the members think about their health plan. How do they interact? How do they want to? What are the employer group expectations? It's making things easier and taking it off their plate and not making them do the work. It's the same on the staff side. So I think about having all of that information at the fingertips, right? Is if we outsource that, then that's something that the nurses potentially didn't have access to, or it wasn't in real time. And how do we get that information back to the health plan from those other vendors? So really looking at, I don't want the nurses to be in the dark, that as they're having the conversations about all those other conditions and the life events and the social determinants of health, the biometrics conversation and that information needs to be part of that conversation. They can't be missing those key pieces that are going to affect the member, right? And they tie back to all the things that the health plan and the employer groups choose in their benefits. So if I take the diabetes, for example, well, there's benefits that they need to know about within their product design and benefit, about which glucometer is on their formulary and what strips and how to renew all of that. And oh, by the way, I'm managing diabetes, but I have all these other things going on. So when you're starting to miss part of those pieces and don't bring them back in, then you really are leaving both the member and the nurse in the dark, and you can't really then engage them and treat them holistically without that information. I think the other thing is, I mentioned the benefit designs and the claims and all of that, is our employer groups are also paying for all those services from the health plan. And so if I'm already managing those members in care management or wellness activities and programs within the health plan, and I'm already treating those other conditions, then I'm also treating the diabetes and those other conditions. And so now they're getting two engagements from potentially all these different vendors and apps. And so we shouldn't be causing confusion for the member. They shouldn't have to know which one do they contact when, and do I only contact these people for diabetes, and then I go back to my health plan for those other things. So I think that's the other piece that we have to be cognizant of as we start looking at that, and why it's important for the health plan and their care managers to own that relationship and that whole picture.
Absolutely, that makes sense. And the third piece of the puzzle that comes to mind is, we talked about the members, we talked about the staff, but then there's also the health plan itself. And we talked about the maze and the reaction my parents had about their health plan, and I won't say which one it is. But when you're doing all of this good work and bringing this value and building relationships, like, there's real brand equity associated with that. And when you think about outsourcing to a third party, usually that third party's name is all over the service and all over the app, which is a real missed opportunity, I think, for the health plans.
Yeah, I agree. I think it's also, part of the employer group too, depending how they brand that and how they want to brand that. But I think, the health plans spend a lot of time on member engagement and getting to know their members and putting that brand out there. And they've been a trusted resource for those members and employer groups in a lot of cases for a lot of years. And so they're trusting that brand. And so I think that's an experience that, as an executive leader, that I didn't want to lose control of, also along with that engagement and having all that information already at the fingertips in the health plans. And I wanted to make sure we were putting the customers first. And the customers first could be the member, it could be the employer group as well. And we were really wanting to offer superior service. And that's intertwined then with the brand image and what you're offering them. And part of that is biometric and digital tools and engagement that each health plan should have and own in order to service their members at that highest level. And when I think about it, those care managers are a human touch point for the health plan. What a great relationship to have to help to build that brand. Nurses are one of the trusted, number one trusted professions, and you have them in your health plan, and they're great resources. So I think if that's the only human touch point potentially that members have outside of maybe customer service, then why would you want to outsource that? So to me, if it's possible, plans should continue to own that experience, but you have to make it a way that's easy for the member and scalable for your staff as well.
So Susan, that's a perfect segue. So we started this talking about how there's this huge opportunity, and sales is asking for it, employers are asking for it. How can we use the technology and the everything we have available today to capture biometrics and other forms of RPM and bring that in-house to transform the information and the way that we care for our members? And if you are using the traditional workflow, the answer is have to add headcount. Add headcount costs too much. That means you have to outsource. And what I've heard from you these last few minutes is that outsourcing, it's really just not the ideal option for a lot of different reasons. So if you're not going to outsource, that means that you have to think about your workflow differently, right? You can't achieve different results if you're doing the same thing, paraphrasing the famous quote there. So once you went through this thought process with your team and you realized, okay, something has to change. I have to bring this in-house. We have to continue to compete and differentiate and win our business. and we have to keep that relationship we've worked so hard to build with our members. What happens next? How did your frame of mind change when you started thinking about your team's workflow?
Well, I think it was just, it's just a moment that you recognize there was opportunity to change what you've always done. And not to say that what you've always done was bad. It was just wasn't in a manner that potentially that you could do at scale. And you had to figure out a way to do that, to your point, without adding headcount. And so immediately, to me, it's technology, right? The way things are built now, whether it's RPM and the way that's advanced in the last few years, and just digital as well. But it was, how am I going to extend the reach of that staff? I know when I looked at the current process in our telephonic outreach, we were spending maybe 75 minutes at a time in a 6-month period, actually directly engaging with a member on their healthcare. That was shocking. And I think when you think about bringing digital in and taking on the biometrics and scaling your care management programs, as you can't always do what you always did, right? So I think that's one of the quotes that we always talk about, definition of insanity, right? So I think I knew immediately, in order to do everything that I had wanted to do or promised or work with the sales team and the employer groups, is you're gonna have to figure out a way to scale that. And the nurses are using their time at the top of their license when they're engaging with members, but I could use a mix of technology and touch to do that and bring in those biometrics and handle all the data and information that was coming in. So something had to change. And so definitely, as you can see here, that's what we needed to do.
Yeah, so and I love that. On the marketing side, we talk about optimizing the marketing mix. And I think that's a lot of what you're talking about here. Whereas, going back 10, 15 years even, marketing was all about sending mail to everyone, and now, we'll still use mail. It's kind of coming back in certain situations, but, email, social channels, text messages, like we've evolved to try to take advantage of the channels that people want to use most. So was that part of what you were thinking about?
Most definitely. And I think marketing became, a really great partner in that, and thinking about omni-channel. And that's what I was looking for in a partner, to bring in digital to an enterprise and digitalize all of my care management things, everything that was, great work, but also scaling the number of members I was able to reach. So if I'm going to bring in that biometrics and reach more diabetics or people that had cholesterol and high blood pressure and all those things together, not just reach the top, less than 5% of the population that had the chronic conditions and catastrophic, I'm going to have to use digital to do that. And really look at how we're going to make a digital care management approach that removes that repetitive work from the care management teams and empowers them as clinicians to operate, like I said earlier, at the top of their license, and then reduce that friction for the members as well, so that they want to come back and engage. And we don't have to worry about, am I going to be able to reach them at home or send them a piece of mail that they might not even be at their house anymore. They might be with, a child, especially now during COVID, right? Look at everybody that's commingled and gone somewhere else. I could send all the mail I wanted and I wouldn't be able to reach them. So I think that was the goal, as well as how to scale and get a higher volume of engaged members without increasing staff. And I think that was the really important piece when looking for that partnership, is how do we have a shared goal for staff, for health plans, providers, members, employer groups, that we could increase our outreach and bring digital into their lives with their health plan.
The number of increased touch points that you're creating by collecting biometrics. These are things that people are tracking every day, multiple times a day. Not every single one of those touch points has that same depth to it, but it is a reason to connect. It is a reason to get your brand in front of that person and have them thinking about you in all the ways that you're helping them.
I think that's the piece that you can see here. And I'm glad you mentioned that, Rachel, because, I talked earlier about maybe you had 75 minutes in 6 months, but the goal of the nurses at the health plan is to have sustained engagement. We talk about it all the time. And so that's what we were able to see when you implement all the things that I just talked about. When you can go to having hundreds of touch points, that's fantastic. That means you're making real-time, real engagement, right? And making a difference, and members are actually engaging back, and you're able to then really coach and engage them on those biometric measurements. And that's what you want, is more of those touch points.
Absolutely. And when you're using digital, not just digitizing, but digitalizing, which I know sounds like the same word, but to me, digitizing is taking your workflow and making it digital. It's the equivalent of anything you would have written in a letter, you now send in an email and you send it out over a different channel, versus digitalizing is really taking advantage of the power of digital. All the biometric data that's coming in, you don't need a human to look at every single data point, right? I mean, we can program the computers to look for the outliers and then tell you when action is taken. So it's things like that, and you can see all the numbers on the screen where it just opens up opportunities to get that scale and efficiency that you were talking about.
I think too is, we talked about this earlier, and I loved this quote, so I had to write it down, and you gave it to me, so I appreciate this. But this is true when I think about nurses, because we always want to talk to people, right? That's part of our job. That's how we teach. But ultimately, what your goal is, you want to communicate with your members on a regular basis about their biometrics or their health, but you actually only want to talk every once in a while. And I think as nurses, we think the members always want to call into the health plan and talk to us, right? But not really. They just want to communicate, and we have to learn to communicate on their terms and have these tools readily available. So that communication digitally allows in real time to still have your decision, making process going on with your members, better care pathways, all those things that the members want. But it's not always requiring that high touch that we were used to. We can use, to your example, all the technology to harness those insights and gather that information and surface it to the nurses.
Absolutely. Use a couple of quick text messages to schedule your next phone call. Right. Instead of a phone call, to schedule the phone call.
Yes.
So I think that's a good point to transition to the next section of the talk. So we talked about the opportunity that health plans have to start capturing biometric data and harnessing the power of that. The fact that although at first glance it might seem like you have to outsource, there's some real challenges and considerations in thinking about outsourcing this type of service. But if you do want to keep it in-house, there's an equal set of challenges and considerations in how to, you're going to have to adjust and scale your workflow so that you can be cost competitive in offering this type of service. So at this point, we wanted to talk about how to actually design an effective strategy for bringing this in-house, and I'd love to learn some of the requirements that you had when you were thinking about finding a partner to help you do this.
I think some of the first things that I think about is, one, even going back to bringing it into the organization and using the information in the biometrics, is outside of even the care management teams, how important it is to actually break down the silos even within the organization. So I think about having the quality teams use the same biometric information that you're going after on a prospective side, or closing gaps in care and meeting your HEDIS vendor requirements. All of those things are opportunity that you might be getting on the claim side and retrospective, but that you now need on the prospective side, as well as that engagement with the members, and then showing that you're relevant to the employer group. All of those pieces, to me, is when I think about the strategies of what biometrics and digital engagement can bring to a health plan, is so much why at the core, I believe health plans should be owning that piece within their four walls, and that they shouldn't be outsourcing, right, their identity and their management and their brand. And you can share that outside of just care management to all those other teams within the organization. So I think about breaking down those digital walls even within their enterprise, making sure that we're staying competitive holistically as a team, as a company, and then changing the user expectations within that, not only from engagement from the nursing side. They're seeing it relevant for the health plan, that they have tools and technologies they want to use. If I'm able to share that same proactive, live, real-time data that I'm getting now with other teams within the organization, that's maybe less touch points to the members in the future, with a letter about filling a gap in care, right? Or knowing about when was their last test for something, and I can consume that data. But it's really then finding a partner that's not only offering the technology capabilities, but one that will assist in that digital transformation that I just talked about within the enterprise. Biometrics and taking, might be the first thing that's coming into an enterprise and organization that's digital. So how do we help that enterprise transform and bring that in? It's the ability then, I think, to share that future strategy and product roadmap relating to biometrics and digital enhancements, and how do you set me up for success as an enterprise and engaging with members so that I'm staying relevant in their lives and how they want to interact with the health plan through a digital tool, and then also staying relevant for our employer groups that are offering these benefits to their employees.
Absolutely. Let's dig into some of these a little bit deeper, because as they say, the devil's always in the details. So you mentioned differentiation and, making sure that the plan stays competitive. Let's dig into that one a little bit.
Okay. I think one of the things that's really important is, and I mentioned this, is owning that member experience as a health plan. In order to do that and to offer these types of tools and services to be competitive, there's no reason why we shouldn't be staying on top of the latest and greatest technology. I think there's two sides to every coin from that. There's a consumer and an enterprise identity that I think we have to look at in order to stay competitive. So while we took the opportunity to re-examine the digital identity and strategies within the health plan, organizations can think about those challenges related to both the member, the employer group, and the enterprise all at once, and understand how they can maybe take one kind of holistic approach that will meet all of those demands to stay competitive. But that just means you can't bring it in once and say you have it and think you're done. And I think that's the thing that you have to look at in the competitive. Technology is always going to change, and there's going to be the next latest and greatest. And I think before, as a health plan executive, the way things kind of used to work before all these biometrics and digital tools were out there was you didn't have to change that often. And you could kind of do it in-house, and you could maybe build it yourself. And that's just not really so much the case anymore in order to scale and stay competitive and rely on somebody else who's bringing, the latest research to the table, and what members want and what consumers want is extremely important.
Absolutely. So let's switch to talking about scaling. And designing a strategy that really supports that digitalization, not just the digitization. There are a bunch of items on the screen here. Which are the ones that really stand out to you?
The one that I mentioned early on was increasing the capacity of my existing staff. If I was going to say yes to taking this on, and I wanted to say yes, and I want to do more, but with less work, work harder, not, work smarter, not harder. So I think that was the biggest piece. And then one solution. I talked about that disjointed, potential experience that members have, that fragmented, and I go back to that maze. How do I solve for that? And I just want to add one more thing to my members' plates, so as well as my nurses. So there had to be an opportunity to combine both of those goals and make a better experience. Those were the two things, I think, especially. And then,
Yeah, the one thing I would add to that is, now that we're bringing all of this data in-house, again, on the marketing side, on the tech side, one of the best practices is don't collect data you're not going to use. So if you're going to go through the effort of capturing this data and bringing it into the system and making it available, making sure that the folks who need it can access it, and that there is a technology behind the scenes mining it and sending out alerts, and accompanying those alerts with the information needed about that member, so that you can take some action and support them and guide them and making sure that they're getting the care that they need.
You're exactly right. I think that's the other thing that you have to get used to when you start bringing, biometrics in, or that digital information in, is so much now prospective, right? Rather than retrospective. How do you use all of that good information and insights to, one, serve the member, make sure they're staying healthy, but learn from as well, right? And gain insights that you potentially didn't have before, and then marry it with your claims data or your predictive modeling to get a whole picture centric, view of your member is a huge opportunity. And without it, you're missing a lot of great insights that can make a difference to the member as well.
Absolutely. So while we're talking about the member, we've talked about a few times here, on the technology side, we can build anything we want. I had one as a CTO, head of product that I worked with at one point, who was like, we can build anything. With enough time and money, we can build anything. But if you don't do it in a way that drives a great user experience, no one's going to use it. So it's kind of resources not well spent. So when you were thinking about a partner to help you bring biometrics in-house, what were the requirements from the member experience side?
The one thing is I didn't want to replicate what my nurses were already doing, right? So that was part of the transformation. I didn't want a member spending 40 minutes answering questions. I always think about it in the aspect of, if we had 2 or 3 minutes with a member every day, what things would we either want to know from them or want them to know? And it has to be easy and simple. An app has to be that. It can't be overwhelming. And it has to be a way that they want to continue to engage. And they have to be able to get what I think about what's in it for them. What are they also going to receive out of that app, except connecting to the health plan's great nurses, right? So what benefit is it going to be? And so it has to have a wide variety of teaching mechanisms behind the scenes that members don't quite even recognize that's what's happening. And it also has to be, right, at their level and their language, all of those things that are important to communicate. And to make sure that somebody's actually going to be on the other end answering their questions, or know that somebody's looking at that data that's coming in, or the biometric measurements, and that somebody's going to help them. So I think that's the other way, is it has to be that real-time two-way communication that's secure, right? When I think about now, even with the biometric data, is before, if they had to share maybe what their blood sugar was, and now they can do it on an app. They don't have to do it in front of their roommate if they're stuck at home in their apartment during COVID, or at work when we go back to the desk, is again on their phone and making it easy, and using a device, things that they have that are already prescribed by their doctor. What kind of relationship do they already have with the tools and technology in their life that we can meet them where they are?
I think that's a really good point. When I look at the competitive landscape of all the different vendors out there who are involved in capturing and sharing biometrics, it strikes me that many of them are very restrictive about the device that the members are allowed to use to participate in the service. Because like you said, we know that people, they want the device that their doctor prescribes because they trust it. They want to use the device that they've been using for years because they know how to use it. They want to use the device that's on their formulary because they know it's going to be affordable. Like, there are a lot of reasons why people want to use a specific device. And it seems like if you want to really support a lot of people, then the bring your own device approach seems to, though more complicated, I mean, it's definitely solvable. There are lots of vendors out there who do it. But it's one thing that always gives me a little bit of pause, that a lot of vendors are really focused on this one very specific device for their offering.
Yeah, I think too, is members like to see how they're doing. So does the tool give them feedback, right? So visualization, right. A lot of people learn differently. Some people want to read, some people want to see it, but they always want to know how they're doing. So I think that's the other thing, is the app has to be able to show that back to them as well.
Absolutely. So I know we are coming up on the time that we want to spend on Q&A, but we do have one more important point that we wanted to make, and that is partnership. We have talked a lot today about digital transformation. And one thing that just this data point that I heard a couple of years ago at this point that I find just astounding is the fact that in 1958, the average lifespan of a company in the S&P 500 was 61 years. I mean, these are like glorious, storied companies like GE, right, who've been around forever and changed the landscape of business. Today, the lifespan of an average company is less than 20 years. So the implication of that is that these storied companies, the, quote, traditional companies, non-online services, and internet type companies, these are the ones dominating our landscape today. So this digital thing is not a trend, right? It's here to stay. The question is, how do companies who've been around a really long time, transforming yourself digitally is almost impossible. I think Microsoft is the only company that comes to mind who's actually been able to do this successfully. We already mentioned GE. They failed miserably. No one is going to dispute that fact. So how do health plans approach this type of digital transformation in a way that's going to be successful? What do they look for in a partner that's going to help them be able to do this well?
I think it's one that's going to bring in, and I mentioned this earlier, just don't bring me a tool and drop it off, right? If it's going to be new to the organization, it's a newer thought process of how you bring digital into an enterprise and scale that across the enterprise as well. It has to be somebody that's in it for the long haul. That takes time. So it takes time to expand and bring digital and teach and learn all of that. So definitely a partner that's able to do that. I think about boots on the ground, like who's going to continue to help, and then who's going to be a thought leader and continue to bring the next, set of information that I need to make relevant decisions to stay competitive, but also thinks about the user experience, and gives me a tool also that's relevant to members to want to use. And that keeps me up on technology. It's also easy for the staff. That's I think about the whole picture of servicing a client as an enterprise and a health plan that you have to be able to bring to that table. It's not just a vendor with a tool. It has to be that partnership that's going to help you make sure that organization is successful in delivering those best services or biometric tools or digital tools to their members.
Yeah, I think that's exactly right. I mean, you hear a lot of these technology companies call themselves industry agnostic, but I really like this phrase purpose built, because it implies that the partner not only knows the technology, but they also know your business. Right, so you're getting an application that's actually, especially in an industry like healthcare that has so many nuances and regulatory requirements and things like that, and very special language. Having that purpose built, that partner that really understands your business and how your organization works seems like it'd be really important. Yeah. So to wrap this up, we talked about the opportunity that health plans have to capture remote patient monitoring and especially biometric data and bring that in-house, and how that relates to the ability to differentiate and be competitive in the market space. How outsourcing is a viable option. There are certainly plenty of companies you can partner with to do that, but that there are also real challenges to doing that and real threats to your business. Which leads you to the other option, which means bring it in-house. Well, I guess you could do nothing, but, not much to talk about there. No. But if you do bring it in-house, then there are some very significant workflow and digital transformation considerations there. Certainly overcome things that you can overcome. It just takes creative folks and the right partners and the right strategy to do it successfully. Yeah. So before we go to Q&A, any last thoughts, Susan?
I think the one thing, consumer experience has always been at the core of a health plan and member experience. And I think we always thought about that in the way of benefits and claims as being core competencies. And I think, in our conversation today is that whether it's biometrics, digital engagement, care management, all of that to me should be a core competency that the health plan does not want to give away. When I think about the brand and building the relationship and how much they spend time on doing that this just elevates that consumer experience. So I think that we need to look at it that way, that here's a core competency that as a health plan I should own, and it's still part of my brand and my member relationship. That you still have an opportunity to continue to build and make a difference and bring that into your organization and enterprise at scale without having to do it yourself or do it alone, but definitely should be at the foundation and core of what a health plan does.
Wise words, Susan. Every time we talk, I learn something new. I love it.
Good.
All right. Erica, let's get started with the questions.
Yeah, thank you so much, Susan and Rachel, for a great presentation. Looks like we've got some questions already here. So first question is, there's an inundation of abnormal values from patients, given that data comes to us in real time. So how can we cope with information overload and management?
Yeah. You want me to take that one, Rachel, or?
Sure.
Yeah, I think it's a combination. Rachel might have some thoughts on this too. Is when I thought about bringing that information in and handling that many cases or having abnormal value, is how can I use technology to do that? So to Rachel's point earlier, there's a way to set those alerts and thresholds and levels, and then when it's surfaced to the nurse, it's meaningful. It actually tells you what it is, why it alerted to the nurse's dashboard, what's the outcomes or choices that they have to react to that, whether it's, chatting directly with the member or sending information or adding a new care plan. So there's ways to use technology and alerts to streamline that process and then help triage them using technology to do that, and then add the clinician when they need to, but also help the clinician with the answers that they need to provide to that member. So surface that also real time. And then also collecting that data, that lab value, whether it's normal, abnormal, and then bringing that back into the organization for your quality teams or your HEDIS teams or your risk teams to also utilize once the nurse has triaged that as well. I don't know, Rachel, what you think as well.
One of my favorite terms that I've learned over the last few years is something called alert fatigue, which is just like such a great term. But the idea is that you get so many alerts that you ignore them. I have gotten really good at ignoring I'm always late for meetings because the little thing that pops up that tells you it's time for your next meeting, I just ignore it because I'm so used to seeing it. But I think that's the case here as well, is if you don't build your solution in a way that plans for alert fatigue. So I know Wellframe's, the way that we tackle it is built right into our care programs. Let's take diabetes, for example. There are 2 thresholds that the system is looking for. So when someone enters their blood glucose measure, whether it's automatically synced or whether they do it manually, they're the clinical guidelines that the system checks for to see if they're within or out of range. And then we also ask, is this within your own personal range? So we have those 2 measures that we're looking for. And if the reading is out of range for either the personal range or the clinical range, or the member says something to the effect of another question that's built in is, how are you feeling today? Do you have any symptoms that you shouldn't have? And if the answer is yes, we'll trigger an alert to the care manager. And not only an alert something's wrong, but something's wrong and specifically telling them what it is. So whether it's out of their personal range, outside of the clinical range, or whether they're not feeling well. So the care manager will get that quickly and be able to assess that information and react. And if everything's normal, then it just goes right into the system. They don't have to do anything but check on the trend every once in a while.
Thank you. Great to hear how that information is filtered through there. So next question is, when you showed the change from 75 minutes per member to 35 minutes per member, was that the actual time the care manager spends interacting with the member?
Yes, so it most definitely is. And it's when you think about also the number of minutes, it's also the number of touch points. So think how quickly today you text back somebody. So it's not only the length of time, but it's the hundreds of messages that happen in those 35 minutes and the insights that you're able to get. So it's not like spending 35 minutes on the phone versus that 75 minutes in 6 months. It's literally hundreds of touch points or text or data points or alerts, all that information that's coming in that back and forth that you're able to get. So again, it's not just the amount of time, but what's happening in that time.
Thank you. So next question here is, does Wellframe connect with the continuous glucose monitoring systems such as Freestyle Libre?
Not right now. We don't do the continuous CGM. I'm going to say CGM because every time I try to say the whole thing, it just comes out wrong. I know that that's on our roadmap, but today we integrate with, I think it's about 50 different devices. Some are through Bluetooth, most are through something called OCR, which is optical character recognition, which is actually pretty cool. It's computer vision. You like take a picture of the glucometer with your camera and it automatically takes the reading and pulls it into the system. But come to find out that most of the glucometer devices actually are not Bluetooth enabled. And the ones that are tend to be the fancier, more expensive ones. So the OCR is a pretty cool and important feature.
And I think it's really important that, Rachel mentioned that 50 different devices that we have in that partnership with Validic to do that is extremely important to match the members' needs against their formularies and what, their employer groups are choosing or their benefits and products. So to have that wide range of devices that we're able to support.
Thanks so much. It looks like we've got time for a few more here. So next question is, should partners be companies that have a risk-based revenue model or customer success team?
Sorry, can you repeat that? I didn't quite catch the end of it.
Sure. Should partners be companies that have a risk-based revenue model?
Oh. I think
that depends on your organization, right?
No, I think that depends on the organization, the enterprise that's bringing them in and where they are in that journey and how comfortable they feel with that. I think if you can solidify the engagement rates, return on investments that you have, what are the expectations that you're wanting for a service level agreement, for back and forth for all of that. I think that's a good conversation to have and where each organization is at that risk. And what level they're able to take. I think health plans, are dipping their toe in the water on the provider side and taking risk, and taking downside risk and who's doing what. So I think you could think about it on the vendor side as well. So I think it would be wherever that enterprise is and are they ready for that as well.
That's great. And next year, how do you find the actual vendors to assist with this process?
I'm laughing because I feel like the answer to every question these days is Google.
I think a lot of it, I think just health plan executives, they talk, right? There's a lot of information that's out there, all of the conferences and webinars and best practices, what they're hearing from in the market. I think all of that is relevant. And then I suppose as well as when health plans go out for RFPs, right? Or if they work with somebody to help them with that process and bring that back in or do an analysis maybe of the top 10 that are out there. So there's a lot of different ways that health plans bring that in to the organization to start evaluating. But once they do, right, then it's calling current customers, seeing how they're doing and all of that. So there's a process to that for sure.
Absolutely. And I mean, at least when I'm out there doing research on the competitive space, most of the options out there seem to have either started in the provider and health system space or going to direct to employers. So the number of options out there of companies who are really committed to serving health plans seems to be pretty small. And I feel like I'm being set up here to say, go to wellframe.com and learn more. So I'm just going to lean into it and say it. But we'll raise our hand as willing and able and wait to help you.
Well, and I think that's why, the conversation is if you're going to own it as a core competency to bring that back, to the health plan, then you want to own that business as a whole as well and that relationship. So it is key, Rachel. I think it's a good point.
Well, that is all the time that we have left for today. Thank you again, Susan and Rachel, for such a great presentation and to Wellframe for sponsoring today's webinar. To learn more about the content presented in today's webinar, please check out the resources section on the webinar console and please fill out the post-webinar survey. Thank you all again for joining us today, and we hope you have a great afternoon.
Thank you.